Hi, my name is Kandel-Sapkota and today's date is October 17th, 2025. Today in this video, I will be talking about peripheral arterial disease. Also, you can call it PAD in short form. Essentially, I'll be covering these like 8 different topics relating to PAD. So the first one is the definition. So what is the PAD? PAD is a condition where the arteries that supply blood to the extremities, especially legs, they get either narrowed or like blocked and leading to the tissue ischemia. So that is the definition of the PAD. And then there's another topic is classification. So PAD, it comes under the peripheral system disorder, peripheral vascular system disorder, and it could be classified as either chronic or acute depending on the onset of the blockage. Usually like in acute PAD, the causes are like thrombosis or embolism, and they lead to like a sudden like a blockage of the blood flow and leading to the symptoms. Whereas in chronic, there is like a gradual narrowing of the arteries and eventually leading to the decreased blood flow. So usually like is caused is atherosclerosis where the arteries starts like over time they are like hardened and narrowed and leading to the blood flow decrease. So that's the classification of it. And next topic is etiology. So what are the causes of the PAD? I kind of talked about a few causes already in the classification itself. So the reasons are thrombosis, meaning the blood clot forming in the artery itself, or it could be embolism, where the blood clot or like air embolism or fat embolism that formed somewhere else in the body and traveled to the extremity like arteries and eventually caused the blockage in the arteries in the extremities. So that could lead to the PAD. And there's another reason is the atherosclerosis. That's the most common one. And there are like many other causes which could either like contribute to PAD or like cause the PAD. And those are hypertension, smoking, diabetes, hyperlipidemia, and those will eventually lead to the narrowing of the arteries, damage to the artery walls and causing the blood flow issue. So those are the etiologies. And next one is a syndrome. So it's like what syndrome does it come under? What syndrome the PAD comes under? So it comes under the peripheral vascular disorder syndrome. And one of the disease in that syndrome is PAD. So the next topic is clinical manifestation. So what are the clinical manifestations of the PAD? The number one would be intermittent claudication, where after activities you will experience the leg pain and cramping, and also when you look at the skin, like it will look paler, and it will also look like a thin and shiny, with the like hair loss in the area where the blood flow is lacking. And then also you also gonna experience numbness or tingling sensation. And then when you touch the extremities, it will be cold and touch. Also when you feel for the pulses, either the pulses will be weak if there is still some kind of blood supply is happening but not strong enough, then pulses will be weak, or like it will be completely absent if there is no blood flow happening. So those are the clinical manifestations of the PADs. And next one is the diagnostic test. So one of the diagnostic tests used is ABI, ankle brachial pressure index. So where essentially you will be taking the blood pressure on the arm, taking the brachial pressure, and you will be taking the blood pressure on the leg. That will check the ankle pressure. So it's kind of like a ratio of those two blood pressure So if the ABI index is less than 0.9, then it could be called PAD. Or if the ABI is less than 0.4, then that's like a severe PAD, essentially meaning there's like barely any blood supply happening. And then that's one of the diagnostic tests, but there are so many other tests you could do to diagnose the PAD. One of them is Doppler ultrasound, where you will check the blood flow in the arteries, and you can also do the CT scan or MRI or like angiogram to directly visualize the arteries. So those are the diagnostic tests. And next one is differential diagnosis. So it's very important to correctly diagnose the condition, and sometimes you might see some symptoms or signs that could be because of some other condition, not necessarily PAD. So it's very important to like distinguish and differentiate between those conditions. One of the condition is a venous insufficiency. To differentiate the venous insufficiency in PAD, you can differentiate it from the clinical presentations. So in PAD, like I already discussed, the skin will be paler, bluish discoloration, and then numbness, tingling, shiny and thin skin with the hair loss. So those, and then pulses will be either absent or weak. Whereas in venous insufficiency, the skin color discoloration would be different because in this condition, instead of like a blood flow lack, it's like the blood is pooling in the area and blood products are like breaking down and causing the skin color to appear either like a reddish, like brown color, and usually with the patches in the shin and ankles. And then also skin will be like, it will be hard and flaky, and then also you will notice the swelling, which is very important to notice. In PAD you don't necessarily see the swelling, but in PAD you will, because the blood is pulling there, and the veins are like not able to return back the blood flow to the heart, and it's kind of still pulling there, so that will lead to the swelling. So that's the differentiation of the PAD and venous insufficiency. And next topic is possible complications. So possible complications of the PAD are like, it's essentially to do with the blood supply lack, lack of the blood supply in the extremities. So if there is any wound in the extremities, because there is no proper oxygenated blood supply, the wound healing will be delayed. And then there will also be gangrene. And if the blockade is severe, then there is like complete blockage of the blood flow and tissue necrosis and severe ischemia, and that could potentially lead to the need for the amputation below the affected area. So, and then also in PAD, the causes of PAD can also lead to the heart attack or stroke, like if there is embolism or thrombosis, those could essentially travel somewhere else and cause the blockage or like PE, like if it gets traveled to the lungs. If it travels to the brain, then it could cause the brain stroke, or it could cause like if it travels to the coronary arteries, leading to the MI. So those are the essential complications of the PADs. Thank you.